Superficial thrombophlebitis, it's very important AMC exam. It's an inflammation of the vein, and the keyword of it will be tender cord-like vein due to inflammation, and this will lead also plus minus nodule. So if you look at this picture here, you will see an inflamed vein which will be cord-like, and also there is tenderness because there is an inflammation, and with or without nodule. So this is superficial thrombophlebitis. So what is the risk of it? The risk of it will be DVT, which is deep vein thrombosis. So to prevent that, the treatment will be using compression stocking, like here in this picture. This compression stocking will decrease the pain, and also it will decrease the lumen or obstruct the lumen of the vein to prevent formation of thrombi. So it will prevent DVT, or helping at least. Well, the most important part is the drug. The first drug to be given in case of superficial thrombophlebitis is non-steroidal anti-inflammatory drug. This will help prevention of thrombosis by two pathophysiology, which is the first one is decrease the inflammation. So decreasing the inflammation will decrease thrombosis formation. So it will help in prevention of thrombosis, and also to decrease the pain. So it's 2-in-1 drug. The second line, or the second drug to be given, it's not the second line, is low molecular weight heparin. So if you have a patient suffering from superficial thrombophlebitis, the first drug to be given is non-steroidal anti-inflammatory drugs, and also at the same time you should give the patient low molecular weight heparin in order to prevent DVT, along with compression stocking. So what if I asked you which is the most important drug for you? If I want from you to choose from these two drugs, which you will choose the first one, or the best drug for you? The best drug for you is non-steroidal anti-inflammatory drug. So if you need to choose between these two drugs, you should choose non-steroidal anti-inflammatory drug, then low molecular weight heparin. Okay, that's clear, simple, but it is very important. Now let's talk about rupture abdominal aneurysm. Well, the keyword for it is pulsatile abdominal mass with severe abdominal pain radiated to the back. So any pulsatile abdominal mass plus severe abdominal pain radiated to the back, this represents rupture abdominal aneurysm until proved otherwise for IMC exam. So how to proceed with this patient? Well, it would depend. If the patient condition is stable, the blood pressure is equal to or more than 90/50. So the next step will be CT angio, which is the investigation of choice in case of abdominal aneurysm overall. While in case of unstable patient condition, by that the blood pressure is less than 90/50. So the next step will be ultrasound, because we need a rapid investigation in order to know the exact problem, then to proceed directly to the surgery. So if the patient is stable, then CT angio because we have time. But if the patient condition unstable, then we need to do ultrasound, which is fast, and then surgery directly to save patient life. That's all related to this. For full course, please contact us through imcqbook@gmail.com. Thanks and goodbye.